Hi, everyone. Thank you for joining us today for this webinar on supporting virtual care with Ocean. My name is Mélina Cardin, and I'm Marketing Manager at Teletel. We are delighted to have you with us today, and we really hope you will enjoy and benefit from this presentation and discussion. So before we start, I would like to cover a few housekeeping items. First, know that everyone on the call is mute. You will have better sound quality if you connect to the webinar via the telephone number you were provided in the registration confirmation email. Note that we'll have a Q&A period at the end of the presentation. You can submit questions throughout the webinar with the question box at the top right of the WebEx. Also, I want to mention that this webinar will be recorded, and we will share the presentation in the following days via email. So I'm pleased to present today's speaker. So first, to present will be Victoria Badley. Victoria is the VP of Business Operation of Connaissance MD. She has over 15 years of experience. She helps oversee sales, marketing, and revenue growth for the company. Then, Dr. Doug Kavanagh is the Medical Director and co-founder of Connaissance MD. When he isn't working on Ocean, he is a practicing family physician in the Toronto area. Note that we have about 30 minutes of presentation time, and we'll wrap up with questions and answers. Again, you can ask questions at any time in the question box on the top right of the WebEx program. Now, without further ado, I pass the mic over to Victoria to begin the webinar presentation. Over to you, Victoria.
Great. Thank you, Melina. Can you hear me okay? Great. All right. Well, thank you. And I want to thank everybody who's on the line today for taking time out of your day to join us. As you know, we're going to be talking today about the Ocean platform, but more importantly, we're going to share some of the ways that our clinics are using Ocean right now to help support the recent shift to virtual care, as well as we'll discuss some of the complications of providing care during this COVID pandemic. So I'm going to start things out by walking through some of those challenges and the solutions that Ocean helps provide. And then I'm going to hand things over to Doug, and Doug will do a live demo of the technology referencing the products that we're going to talk about first. And he's also going to explain to you how he's using Ocean with his own patients today. So for those of you who aren't familiar with Ocean, I think there's a mix on the line of current Ocean users and those who have not used our product before. Ocean is Canada's leading platform for patient engagement and e-referrals. Today we're focused on the patient engagement side of things. So we've been around for about 7 years, and through that time we've grown into a platform with well over 5,000 forms in our library, and I'll talk a bit more about how important that is in a moment. We also have over 7,000 clinicians in Canada now using our technology. And today, over 265,000 patient forms are completed every month through our platform. So to understand Ocean and how it works and really to understand the value of Ocean, you have to start with our forms. So as I just mentioned, there are thousands of forms in our library, and you have access to those from the moment that you get started using our tools. So our library includes things like validated screening tools, things like the PHQ-9, the GAD-7, well baby screens. We also have intake forms, patient history forms, and then there's a series of administrative forms as well, things like email consent. But the real power of Ocean Forms is not just taking a clipboard paper and translating it into a digital version. The power comes from the way that it allows you to automatically collect structured information from your patients, calculate scores in the background, do things like generating concise clinical notes right in the chart, and updating demographics, and have all that flow right into PSS without even having your patients step into the clinic, which obviously in today's environment is even more important than ever before. So really, again, it's much more than a paper and clipboard. So that powerful forms library provides the basis for every single one of our patient engagement tools. So all of our tools have been designed to give you a way to connect with your patients digitally right across the patient journey. So we see each of those touch points as a really valuable opportunity to be able to collect information from your patients to support their care. So that might mean that you're putting a basic form on your website that allows patients to securely contact you, or even maybe send photos or attachments. Or you might be using our online booking and use that as an opportunity to incorporate maybe a consent form right in the booking flow. Ocean also offers automated appointment reminders. But rather than your typical appointment reminder, which is really just about providing appointment details, Ocean allows you to use that, again, as a touch point to send a relevant form specific to the visit type. So you can start collecting information about the patient's concerns before the visit even starts. At the point of care, Ocean tablets can be used, and they're really helping clinics as they're reopening to provide a safe environment for both patients and staff. So because our check-in kiosks automate check-in and they allow patients to update their own demographics, all of that gives you ways to protect your administrative staff and maintain proper social distancing in the clinic. And of course, you can still use your tablets right in the exam room for form completion. Finally, Ocean has a robust, secure patient message offering, and that allows you to reach either individual patients or groups of patients either after or in between visits. Okay, so we're going to talk today about how Ocean is being used in the current environment that we're all facing. So what we've noticed, interestingly, is, before February or March of this year, I would say Ocean tools certainly were super valuable to clinics. They made them more efficient. They helped improve patient care. But you could argue they were sort of a nice to have. What we're seeing today in a world where we've rapidly shifted to virtual care is that Ocean tools are taking on a whole new role and are really fundamentally supporting clinics in how they deliver care in this virtual environment. So that's what we're going to focus on today. I'm going to highlight the 5 most common concerns that we've heard from our clients and share the different ways that Ocean is helping address those concerns. So if you go back to January or February of this year, we started to hear from our clinics that they needed to implement COVID screening. That was when it first came up. And so our team responded, and Doug went ahead and built the first of many updates to COVID screening forms. As the guidance has changed and evolved, Doug has been keeping those forms up to date and in line with that guidance. And that's one of the really nice things about Ocean is those core tools are updated and you automatically get access to the most recent version of them. We then started helping our clinics to add those screening tools into their flow in different ways. So first we had clinics using online booking. And what we helped them to do was incorporate the screening into that booking flow and even prevent patients from booking in-clinic appointments if they screened positive. We had other clinics that added screening to their appointment reminders. And virtually all of our clinics with check-in kiosks added the screening around that time frame into the check-in flow, so you were automatically screening all of your patients on the check-in kiosk. So as time went on and March came around, suddenly, as you all know, clinics were being asked to change pretty dramatically how they delivered care. We had clinics closing and trying to figure out how do we communicate to our patients about these changes? How do we let them know what to expect? How do we let them know how they can reach us? So again, we were there to help our clinics, many of whom chose at that point to send group messages. So a group message is really just an easy way for your clinic to send a single message template to a list of your patients. So we had clinics sending an updated message just saying, these are our hours, or this is how you can reach us, this is what our virtual care plan is, this is what to expect during a virtual care visit. And all of that was built into their customized templates. We also had clinics use their online booking flow, and they customized the online booking flow. And this is one of the, again, it's a nice thing about Ocean is everything we do, because of that form basis, allows you to really customize and make it your own. So we had clinics customizing and working in details right in that booking flow to tell their patients and inform them what to expect, and also shift straight into virtual booking instead of in-clinic booking. And Doug's going to show you what that looks like in a moment. And then we had some clinics that were just sending individual patient messages to update them about what to expect. So For those of you who use Ocean, you're probably familiar with the fact that it's always been used by, I would say, the vast majority of our clients use it to capture consent, but that consent was typically focused on email in the past. So suddenly we were hearing from our clinics that they really wanted to know that they had in the chart, they had captured consent for virtual visits and what that entailed. So once again, Doug to the rescue, and he updated our core forms and provided some templates for clinics to automatically use. And then we guided our clients in the different ways they could incorporate those virtual visit consent forms, either in the booking process, through a group message. We had some clinics send broad group messages to collect in large groups at once. And of course, they were also built into appointment reminders for a lot of our clients. So then the next hurdle we started hearing at this point, as clinics had started adopting virtual care, we were hearing from clinicians that they had a challenge capturing information from patients before they started the visit. So in some cases that was they needed them to fill out forms, but in other cases we were hearing from clinicians that they wanted a way to capture a summary of the patient's concerns before the visit. You know, with a virtual visit, you typically don't have the advantage of a nurse meeting with the patient first. So Ocean forms, things like the reason for a visit form, really helped fill that gap for a lot of our clients. But I would say arguably a bigger issue that we were hearing was that clinicians, now that they were not seeing their patients in person, they needed a way for patients to be able to securely send images primarily so that they could review them, whether that was a rash or so they could review them before the appointment. So we didn't actually have that feature, and so we quickly went to work and added it, and we released, I want to say about 6 weeks ago, we released what we call patient-authenticated website forms, and those allow you to allow your registered patients to send a message, including an attachment, securely. And again, Doug will show you that in a few moments. So now that takes us basically to today, as clinics are trying to figure out how do we reopen safely. And so among the most recent concerns we're hearing are around how do we safely provide care back in the clinic, how do we keep our staff protected, how do we minimize contact with patients wherever possible. You know, our clinics don't want their patients sitting in waiting rooms unnecessarily, filling in forms or for any other reason. So all the tools that I've just kind of walked you through in various ways allow you to capture any information that you need from the patient before the visit so they're not unnecessarily sitting there. Additionally, what we're seeing is that a lot of clinics are actually adding check-in kiosks, even clinics that didn't have them before. And they're using those to complete check-in because the patient can then automatically change their status in the chart. They can update their demographics, they can do a screening, and all of that can be done without having any close contact with the administrative staff. So that's actually turned out to be a really helpful tool in reopening. So that really covers the leading concerns that we've been hearing and the different ways that we've been trying to help our clinics with the Ocean technology. So I'm about to hand things over to Doug to walk you through the live portion of the demo, which is obviously the most interesting part of all this. But before I do that, I just wanted to draw your attention to, we do have a resource on our website. If you go to ocean.tips/COVID, you'll find a summary of all of the COVID-specific tools that we've built and an explanation, and you can even demo them there. So that's just a good resource to be aware of, particularly if you're an Ocean user today. Those are all available to you right away. So with that said, I'm going to pass things over to Doug. Take it away.
All right, thanks, Victoria. You can hear me okay? Hi, everyone. We're very excited. I'm excited to guide you through some of these tools in Ocean, particularly for virtual care. So I'll be speaking about the tools and giving my perspective as a physician, while my colleague Melissa here is going to manage the walkthrough just to make a little bit easier for everyone. So if something is a little bit off or if there's a glitch, apologies in advance. So bear with us. It is a live demo, and We're all scattered here due to the pandemic, so we appreciate your patience if there's any issues. So let's get started, Melissa. The first solution we're going to show you is online booking. You can see a clinic website here. This is the demo CMD Toronto clinic website. Our online booking solution is designed so you can easily host it directly on your website. Patients find it incredibly easy to use, especially since there's no login, patient portal sign up, or anything like that required. It's also mobile friendly, so you can access the booking link from any device. And in fact, you don't even need a website. It's really just a link that you can host as well if you like. So Melissa's going to click on Book Online, or Book a Virtual Visit. And that's going to take us to the online booking page. And you'll note there's a clinic logo and an introduction here, which you can customize if you like. Patients need to enter their first name, last name, health number, and birth date, as you can see. And that is what allows us to validate their chart against their record in PS Suite to ensure that they are an existing patient. I should, however, note that Ocean can allow clinics to accept new patients, so they'd still fill out this form, but there doesn't necessarily need to be a chart. So that's a handy thing for walk-in clinics to accept brand new patients, but that's not how my clinic's set up. So after Martha's checked in, so it's just checking against PSS here. Now we know that there is indeed a valid chart. After she's checked in, Ocean presents a list of eligible providers for her. So Martha's one of my patients, and that's why you can see me there. She's also able to book with our nurse, Eddie Vetter, here. And this is similar to my real clinic, where we've set up restrictions so that patients can only book with their own doctor. I also have a locum, so they can also book with my locum. It's really up to your clinic how you want to set it up. They can sometimes book with the nurse. Again, that's up to you. Once the provider is chosen, you can see a brief customizable form here. And this is something your clinic can tailor to its own needs. Generally, just collects basic contact information like the email, which it's pulled from the chart already, as you can see, along with an option to select the type of appointment. Right now, because we're mostly virtual, we just have those two options. But in a normal environment, you might have well-baby visits or periodic health exams and so on. And then they can type the reason for visit. And these things will feed into PS Suite downstream, as you'll see. So for today's example, Martha's going to book a video visit for herself. Ocean integrates nicely with any type of video visit or virtual visit. So that includes the most common by far, which are telephone visits. But many video visit solutions will work very nicely alongside Ocean. So for example, you might be familiar with the TELUS virtual visit product, which is excellent. I've used it and it works seamlessly. So to demonstrate how all this works, we'll just go ahead and we'll book this video visit appointment. But you see, before Melissa's actually booking for Martha here, you can see that there is a form here. And this is another customizable form. In this case, the virtual care consent form. So you can have this administered elsewhere, like through our email reminders. But we thought it would be handy, especially when somebody's booking a virtual appointment, to capture it right at this point in time. So this is a form that we use in our clinic. I think we've tweaked it a bit from this demo form, but it's based on the OMA's recommended wording for virtual care consent. So you can rest assured that medical legally you're doing what most of us are doing if you use it. But you can have any other form in there if you like, clinic policies, that sort of thing. So once that form is complete, or other forms are completed, the availabilities in my booking schedule are now shown. In my clinic, patients can book directly into almost any open slot in my PSS schedule, just with a few extra restrictions specific to online booking. So the actual time slots that we make available here are completely within our clinic's control. For example, we can restrict specific time slots to specific appointment types, well babies, for example, in a particular shift. We can also control how far in advance patients can book. My clinic is 1 to 14 days, for example, no further than that, so that we get our summer vacation. But some clinics allow bookings farther off in the future. Our office administrator users really love how Ocean uses your existing configuration within PS Suite's appointment scheduler. In other words, your staff doesn't have to worry about going into Ocean and configuring a parallel, completely separate online booking schedule in Ocean and then trying to keep it in sync with PSS. In fact, your normally booked hours in PS Suite Scheduler template are used automatically, so it will just line up nicely in that regard. But it's also easy to add additional constraints in Ocean to prevent patients from booking online at specific times that you want to reserve for manual bookings. For example, my clinic blocked off each afternoon from 3 p.m. onward for online bookings to reserve those slots for manual bookings of urgent same-day requests. That's very easy to do. Similarly, our staff didn't want to be overloaded on any given day with too many physicals or new patient visits, so we've restricted the online bookings of those visit types to just 1 per day. You can even take the complete opposite approach and lock down your whole schedule, and then you just open up specific shifts, if you will, for online booking. And that's a nice way to sort of dip your toes in the water to see how the online bookings are going. So some providers, for example, just have Friday mornings for online booking. It depends on your provider's specific needs, but Ocean's flexibility is very likely to be helpful there. When Martha picks her desired time, so 2:15 here, the appointment information is shown, and she can confirm that. She can also review or enter her email address here to receive the email confirmation. So once she books the appointment, and we can go ahead and do that, that email confirmation will be sent to her, and we'll go into more details soon about that. So here it is, booking in live time, in real time, into the PSS schedule. Now the confirmation details are shown, and you can see it's very clear it's a virtual visit appointment. And from here, Martha can add the appointment to her electronic calendar. So there's an Add to Google Calendar button there, for example. Or she can print a confirmation sheet. So some of my patients, particularly older patients, like to have that printed sheet of paper for their appointment. So you can do that. You can also see below there a visit preparation form. And this is customizable as well. You can use it to display or collect any information pertinent to the visit. And also, what's quite cool here is there's a text box that you can type in. So patients will often use this opportunity to tell me a bit more about the reason for visit. So if they're booking a virtual consult for a headache, they might tell me more about the headache here. And that information will go directly into the chart as a progress note. It gives me a nice little head start on the history taking of the visit. That's up to you whether you want to include that or not. Some clinics just use that form to remind patients about clinic policies, for example. So now Melissa is going to switch into PS Suite so we can take a look at the schedule and what Ocean has done with this online booking. So bear with us. This just takes a minute or two. Here we go. That was quick, Melissa. So on July 20th, right here, we can see that Martha's appointment is booked already. And the appointment type is there, so virtual visit. You can customize that to your appointment types in PSS, for example. So if you have video visit or well baby, Ocean will set that to the correct type depending on your mappings. And it also says virtual visit, which allows it to integrate with Telus' solution, for example, and booked online to make it very clear where this appointment came from. We're frequently asked by clients whether these online bookings can be done just inline like this as part of the regular schedule while your secretaries are booking over the phone. Is there a concern about conflicts? The answer is no, not really. We haven't seen any significant issues in our own clinic, and that's because Ocean and PS Suite are continuously talking in real time. There's very, very little opportunity for any appointment to sneak in there. And in fact, you saw how Melissa picked a time slot. If she picked that and then a secretary booked into that same slot right before Martha was able to click book, then Martha would get an error telling her that, sorry, the slot's already taken. So we really take strides to minimize double bookings because I know personally what a hassle that is for the front desk. So now we're going to pop into Martha's inbox, the patient's inbox, so we can have a look at the confirmation email. Oh, actually, sorry, I should highlight is there anything in the chart here? Oh, no, sorry, we'll come back to that. So we'll jump over to the email now, and you can see what it looks like for Martha. So she gets a nice looking email here that makes it very clear it's a virtual visit. So you can see some key differences, again, compared to an in-person visit. If it was an in-person visit, you'd see the clinic address, for example. In this case, we don't have that. And in fact, that's something we removed it in response to feedback from our clinics, including my own, where patients were showing up despite all of this wording, simply because they saw the clinic address. And that was pretty scary back in March and April. So we've iterated and improved it in response to that feedback. And I think these little details have made a big difference in terms of our clinic's workflow. You'll also note the email includes a link to cancel or reschedule the appointment, a big blue button there. That's really easy for patients. Again, they don't need to sign in or do anything fancy to cancel an appointment. Rescheduling is as easy as booking was. And that's been really helpful for our front desk because we don't get those urgent cancellations or frustrated patients who haven't been able to get through on the phone simply because they want to cancel an appointment. That's been a big time saver. So that's online booking. Now we're going to pause and take a look at another tool that's helpful before the visit, whether it's booked online or otherwise. And this product is called Patient Reminders. And patient reminders are automated messages sent by Ocean that are scheduled around the existing appointments in your provider schedule. Now, Ocean will send these reminder messages to the patient using an email with a secure link. And thanks to Ocean's email consent collection and other tools, our clinic has over 90% emails. 90% of our patients have emails, I should say. But coming soon, we'll also be able to send Ocean reminders using SMS. So that'll give us yet another way of reaching patients, and I'm very excited about that. As Victoria mentioned, reminders can quite obviously allow patients to not just see the appointment, but confirm directly in your PSS schedule. But Ocean goes beyond this. It allows patients to complete specific forms in these reminders to help prepare for the visit. And these forms can key in on the visit type and other criteria to be very useful for whatever clinical workflow you may have. For example, in our clinic, we use Ocean reminders to send a CDM diabetes form to patients so they complete their recent blood pressure and their hypoglycemia symptoms and so on. And that will pre-populate the CDM custom form in PSS. Awesome, huge time saver. Similarly, for periodic health exams or physicals, if you call them that, all the routine questions, whether it's sunscreen or alcohol use, are covered by that. And it's just one less thing that you and your staff have to worry about sending to patients. You can actually use Ocean reminders to send forms, not just before appointments, but also after. And that is fantastic for patient satisfaction surveys. So in our family health team, like most, we have a patient satisfaction questionnaire. It's also great for quality improvement projects or mental health follow-up if you just started an antidepressant, for example. It's up to you how you want to use that. Today, we're going to show you how patients interact with Ocean reminders and how you can use them to screen for COVID-19, particularly for in-person visits, where it's more relevant. And I think this has likely become our most popular use of Ocean reminders for obvious reasons. So as you can see, this is an email from Norman, and he has an upcoming appointment. So this email was sent by the Ocean Reminders engine. In the email, you can see the appointment details, the provider, and the link right there to confirm appointment. The content of this email is heavily customizable. For example, in our clinic, and in this case, the email is used as an opportunity to present the missed appointment policy, if you want to warn them about a fee, for example, or a 24-hour notice. Again, it's up to you. Alyssa is going to kindly click the confirm appointment link now. And you can see, first we show just a basic form to collect the patient's birth date. Ocean just does this for security reasons to make sure the email is sent to the right patient. He's then prompted after clicking next. Now, here's the appointment confirmation. It's been confirmed. Great. After clicking next, you'll see the COVID-19 screen. As Victoria said, this form has been heavily improved, iterated upon on a daily basis for a little while. And so we really try to keep it in line with the national and provincial guidelines. So you can see all the symptoms have been updated to reflect the latest evidence. You can use reminders, as I mentioned, for other forms and visit types. So the baby developmental screens, for example, for your well baby visits. PHQ-9s can be sent automatically for your mental health visits. Fortunately for Norman, in this case, he had a negative COVID screen. And now that he's confirmed this appointment and passed the screen, let's see how it looks in the scheduler, Melissa. So Melissa's just going to switch over to PSS. Okay, so you can see Norman's schedule there. And when he confirms the appointment, there's a little green circle that appears. And that tells us that he's both confirmed his appointment and he's passed his COVID screen. Oh, there we go. I don't know why there's a little pause there. You can see a little green circle there. You can actually look at COVID screening results if you like. This is a bit of an aside. But if this is a very important workflow for you, you might be interested to see how you can review all of your COVID screening results in the Ocean portal. So we'll just take the opportunity here to go from PSS into the Ocean portal, which normally doesn't require any sort of login there. And when you open up the day sheet, you can see here in your day sheet are these little green asterisks and red asterisks. Green is good. That's a negative COVID screen, no symptoms, no exposure. Red means there was a screening concern. So these are the patients that your clinic would, of course, want to follow up with. Now, fortunately, in this case, we know that if somebody has a positive screen, Ocean's form has already warned them to not attend the appointment if it's an in-person appointment, at least not until the clinic's had a chance to discuss it with her on the phone in this case. So this has saved a lot of panic situations where patients show up as potential super spreaders in the midst of a clinic day. But it also provides that really helpful short-term guidance for the patient when they're not sure what to do. So what we found is when patients do screen positive, we reach out to them. Our front desk knows to do that. They go get tested. Once they have a negative result, usually it's fine to proceed with an appointment. So now we're going to return to Norman's chart. Okay, here's Norman's chart. Imagine that prior to his appointment, we'd like him to complete some additional forms ahead of time. So instead of relying on the Ocean reminders like we did earlier to automatically send certain forms, we can manually send any form in the library along with any attachment from his chart and other notes just on a case-by-case basis. So that would naturally depend on what's going on with the patient's history and how you need to interact with them. A lab requisition is a very common example of something you might want to send. With Ocean and our PS Suite integration, we've made it really, really easy to send these sorts of one-off messages right from the patient's chart. One feature we're particularly proud of is the green barring note selection feature. So you can see here Melissa's clicked on the lab requisition form. If there were letters or consult reports you want to send to the patient, you can green bar those as well. Ocean will automatically send those and include them as an attachment. Melissa will show you how that works when she clicks email now. So Ocean prompts for the name of the attachment. Instead of some generic name, she can type lab requisition. That really helps patients understand what the attachment is, especially if they download it and then come back to it later. When we click OK here, Ocean automatically signs you in and launches the messaging pane in the Ocean portal. There's no login required here. You can see in this send email screen that the there's an email, a subject, so all this is pre-populated for me. The attachment from the chart is included there. And so we can proceed to just type a note, provide additional context in a secure message if we'd like. We can also add a G8A7 form for the patient. Suppose he's coming in for an anxiety-related visit. This will give us a score that we can then graph or search in PSS after the fact. And we can go ahead and send that. Now, one thing I should note is that if you keep sending the same kind of message over and over, whether it's a lab requisition or the most popular one now, your COVID test was negative, you can just save that as a template and just pick it from the menu later on. That way you don't have to retype it each time. So Norman, after we click send here, instantly receives an email with a link to that message. And that link will work on his iPhone, his Android phone, his desktop computer. It doesn't matter. And again, he doesn't need to know anything about Ocean. He just clicks the link. Perhaps he enters his birthday for validation. He's able to download that attachment, complete the G87 form, and proceed. And all of that information will be summarized in the chart in a very easy-to-read progress note in PSS. So those are patient messages. Really, really easy to use. Probably the single thing with Ocean that I interact with more than anything else. And it's been a lifesaver over the past few months, perhaps literally. Okay, now we'll talk about website forms. This is another way your patients can connect online. So the idea is to let you host any form on your clinic website. We've returned here to our demo clinic's website. And you can see a bunch of different links. And any one of these could link to an Ocean website form. Now, they've been really helpful for my colleagues and I, particularly during the pandemic. They allow patients to send us requests and secure messages directly. Our website's mobile friendly, as are the website forms. They've taken a big load off of our front desk and our telephone line. We rarely get complaints about our telephone line being busy these days because patients are just interacting with us electronically. Our patients use it for all sorts of things, particularly to send medical documents, photos of their rashes or other clinical concerns. They can also use our website forms for administrative tasks, canceling appointments, or perhaps requesting a prescription renewal if they haven't done that through the pharmacy. And we even have a waiting list for new patients on our website, and that's an Ocean website form. Most relevant now would be the automated COVID-19 triaging form. Similar to the screening form, this is a big button on our website that says, are you concerned about COVID-19? Click here, and that allows them to complete a similar symptom and exposure questionnaire. But the nice thing about it is it tells them what to do next, whether they should go in for testing, whether they should contact us, or whether they should just go straight to Emerge if they have some concerning symptom. What we're doing now is redirecting all patients with COVID concerns to complete that triaging form first, and then we can see the results. And if it's a negative screen, we're not particularly worried. If it's a positive screen, then we can give them additional guidance. So these website forms are so useful. You can actually use them without a website. They're just a link, and you can distribute that however you like. Patients can bookmark it. It's much like our online booking that way, in fact. So in this example, we're going to show you how patients can send us a document. So on our demo website, we have another button here labeled Send a Message, which Melissa's just clicked. So after clicking this link, similar to the online booking, Martha confirms her personal information. And we use this to ensure that the patient is indeed within your clinic. They have a chart. And once she does that, she can attach a file and send an associated message to describe the issue. So this is quite a simple form, as you can see. And they're free to type whatever they like here. And then they can indicate that they would like to include an attachment with the message. Because Ocean's secure and encrypted, unlike email, for example, our patients have been a lot more comfortable sharing photos and personal concerns using this form. Again, since there's no patient portal sign-up required, it's accessible and easy to use for all of our patients, including our elderly and their family members. So it really fills a key gap that we found, which is how do patients send us stuff without worrying about it leaking to Google or somebody else hacking into their email account. So that's it. It's been sent. And now the submission's in the Ocean portal queued up for your staff to review, whether you want to review them yourself or have your front desk do it. It's easy to delegate. It's very easy to import these into the chart just with a single click to get the secure message. So hopefully that gives you an idea of how website forms work. And now we're going to demonstrate some of our cool hardware. However, we're doing this virtually. So you're seeing here a kiosk. So use your imagination that there's this beautiful looking stand encapsulating this screen that Melissa's showing you here. So although most visits are virtual, of course, we do need to see some patients in person, whether it's for an immunization or polio shot or some important physical exam. So to maintain social distancing and to protect our front desk staff, we deployed an Ocean kiosk right at the front of our waiting room as part of a strict check-in protocol. So when patients arrive, they sanitize their hands, they put on a mask if they don't have one already, and then they proceed to use the kiosk. The kiosk allows them to check in, update their demographics, complete additional screening forms, all without interacting with our front desk staff. And then when they do check in, they're marked in the schedule as being arrived, and that allows us to quickly usher the patient into a room, which in effect keeps our waiting room nice and sparse, mostly empty, and consequently safer. Our higher volume clinics have really appreciated the kiosk for this reason. So we're going to demonstrate now with our patient Jill. She's going to check in with her health number here. And you'll notice Melissa's just typing it. Patients could tap it in. Or if you're in a province like ours that supports health card swipe, they can do that as well if that's easier. The first screen the patient sees is a customizable introductory screen. You can put your clinic protocol here. There's a privacy disclaimer. And they can choose their language. So for multilingual clinics, whether it's English or in French or another language, patients can choose that. And in fact, that can key in on the patient's chart as well. For example, if we know that they're francophone, then they won't have to choose that option. So we'll go ahead and proceed to the next screen. Here you can see the contact information. This is pulled from PSS. Well, this is changing her phone number. We're doing that so you can see what happens in the chart when we're done. And then on the next screen, familiar theme here, the kiosk will screen for COVID-19. So even though we did this with the email reminder, I feel it's important to rescreen for any new symptoms or exposures since that reminder was sent, especially since they're physically at the clinic now. And although the questions are the same, the recommendations in the form are quite different. They're already here, so we can't tell them to stay home. We have to give them precise instructions. So you can see Melissa has indicated that, unfortunately, this patient has a cough, so she may indeed be infectious. We tell them to sanitize their hands, put on a mask immediately, hopefully they already have one, and then ask for help with reception. So now we can go back into PS Suite to look at what's changed. So Melissa's going to flip back over, and we'll have a look at the schedule, where you can see Jill's been marked as arrived automatically by the kiosk, which is great. We know she's here. If I'm sitting in the back room, hopefully we can move her to an exam room for safe treatment. If we go to Jill's chart now, you can see the results of her screen. There's a lot of red, a lot of red there. Any of the clinical notes from earlier you'll see as well. So if she's completed forms from email reminders, it will go right there. So this check-in process was pretty quick. We didn't have any other intake forms that she completed other than the COVID screen. However, in my clinic and many others, we often do include forms at this stage. During flu season, I think this flu season is the most important ever in a lot of ways, except for maybe early in the century. There is a flu shot invitation that intelligently asks whether they've had a flu shot before this season. If not, we ask them if they would like one. So we don't re-ask if they've had theirs, but otherwise we do. We also have a smoking screen for patients who have a smoking history so that we can take the opportunity to counsel them about that. It's really flexible to set up these kiosk rules to decide what form should display and when. And it's up to your clinical team to decide. It's easy to adapt for all sorts of different clinical workflows, whether it's a specialist clinic or primary care. And it's really easy to develop new QI initiatives using the kiosk as well. We've seen some pretty amazing stuff developed by some of our family health teams and other leader physicians and allied health professionals in that regard. So for patients who have longer forms needing completion, you don't have to use the kiosk. What our staff does is we ask them to complete it on an Ocean patient tablet. And that's really nice because patients can bring that tablet either to a private seat in the waiting room, or they can complete it in an exam room. They can take their time, and thus you have more flexibility. They work very similarly to the kiosks, but when the patients receive the tablet, they are likely completing quite a different set of forms. So for example, our clinic's obesity specialist has a long intake form for initial consults to collect the diet history and the comorbidity history. That's ideal for the tablet. Our physicians doing obstetrical care use it to help automatically complete the perinatal forms, also tremendous time saver. So this concludes our demo. I wish we had more time. We could just go on for hours showing you different stuff. But hopefully this brief demo gave you some ideas of the many different ways you can use Ocean to support your patient engagement strategy. In this new world of virtual care, there are just so many opportunities for us to re-examine our clinical workflows. And it's more important than ever to do so, particularly to improve patient safety and hopefully improve your clinic's efficiency while you're at it. I'm now going to pass it back to Victoria to go over pricing information.
Great, thanks, Doug. So we can just get the slide, great. So our pricing is all available on our website. If you go to cognizantmd.com/pricing, you can find it all there. But we've got it all laid out for you on this slide. So the way it works is we have a sort of a la carte approach to pricing, which means you can add or remove licenses as you like. Our patient messages and reminders license, that is a user license, so that would be a provider, and that is $25 per month per user license. I should note that a provider also automatically gets an administrative delegate that can send on their behalf for that license fee. For anybody who wanted to add online booking, you do first have to have a user license on our messages and reminders in order to add online booking. It's considered an add-on, and that's another $25 a month per provider schedule. There is a one-time setup fee, and that setup fee covers the whole clinic regardless of how many schedules or providers are interested in adding online booking. So website forms, that includes the patient-authenticated website forms where you can add attachments as well as just a standard website form. That is $55 a month, and that gets you one URL. It might incorporate multiple forms on that one URL, but it's $55 a month per link, basically. Patient tablets and check-in kiosks are priced the same way. So for each hardware device that you have, it is a $55 a month per device fee. And then finally, we did not get into Ocean Studies in today's presentation, but Ocean Studies is another module that allows you to collect information, de-identified responses to patient forms, and have them flow into a aggregate study database. So that's often used for things like patient-reported outcome measures. So that's $100 a month, and that gets you unlimited. So across the board, all of our fees automatically incorporate access to the full library, access to the eForm Builder, and unlimited completion, so unlimited use with any of your patients. So, and as it notes at the top, it's good to be aware that we don't have contracts, there's a contract with TELUS, but there's no commitments, there's no minimums, so you can adjust as you need if you're growing or if things change, and that certainly was the case in coronavirus. Through when the pandemic first hit, we had a ton of our clients shifting their licenses, some who wanted to turn off their tablets for the period of time that the clinic was closed, but what they did was they moved to patient messages and reminders to allow them to still do all their form completion. And so we supported all of that shifting of licenses to support what our clients' needs were in that moment. So Melina, maybe I'll pass it back to you just in the interest of time. I know we're 3 minutes over.
Yes, thank you, Doug and Victoria. So thank you, everyone, for your time. Again, if you have further questions or if you're interested in learning more about Ocean, you can contact directly info@connaissantmd.com, or you can connect with your TELUS Health account manager directly. So the conversation was really engaging. Thank you again to the Ocean team for the presentation, and have a great rest of the day, everyone.
Great. Thanks so much.
Thanks, Melissa.
Take care.
Thanks, Victoria. Thanks, everyone.
Thanks, guys. Have a good one.